I'm Anes Chanel Nitero, and today we are going to discuss about non-clinical jobs. Some individuals might want to work directly with patients, while others might prefer to work in a supportive behind-the-scenes position at a healthcare facility. And both alternatives are possible. So today, the overview of this presentation is we are going to discuss about examples of non-clinical jobs. Also, we are going to talk about what allied health professions are, and as well as some examples of allied health professions. And also we are going to discuss about LPN, RN, and nurse practitioner levels of nursing. First of all, let's talk about examples of non-clinical job. The first position can be like being a medical transcriptionist, and this is all about transcribing recorded patients' histories and clinical information. The skills required in this position are medical terminology and language, and also having writing skills to transfer abbreviated and simplified note taking into usable information. Also, the education required is like having an associate degree in medical transcriptionist at a community college. Also, another position is being a medical secretary, and this is all about managing information flow within medical offices, just with any as with any business office. The skills required is like having office software skills and also understanding medical terminology. Also, the education is like having a training at vocational high school or training institutes and community colleges. And another position is like being a healthcare administrator, and they are in charge of financial management, staff coordination, project planning, and also candidates should understand finance, business organization, law and ethics as they relate to a healthcare setting, and those are the skills required in that position. And the education is having a master's degree in healthcare administration, and some people might prefer getting an MBA with concentration in healthcare. So let's go on. What are allied health professions? Allied health professions are professions in the healthcare segment which are in charge of identifying, evaluating, and preventing diseases and disorders, dietary and nutrition services, and rehabilitation and health systems management. And let's talk about different examples of allied health professions. Medical administration. Medical office administration encompasses all of managerial and support roles that provide administrative services in a medical office setting, including records and billing clerks, receptionists, office managers, and administrative assistants. This means that they are in charge of coordinating different projects, coordinating how employees are working, but in a healthcare setting. And also another example of an allied health profession is like medical social worker. This person is the person who is in charge of in a hospital and for offering counseling to patients and their families, and ensuring that discharged patients will receive appropriate care in the community. This means that they are in charge of discussing with patients, knowing how they are doing, knowing their problems, and then giving them some advices. And also, we can be an hospital technician. This is another example of an allied health profession. Hospital technicians work in laboratories and assist doctors in diagnosing, testing, and treating illnesses and diseases in patients. This means that they are more of in the technology field within a healthcare setting. And also, you can be a nurse practitioner, which we are going to look at in our following part of this presentation. And according to the American Association of Nurse practitioners are licensed autonomous clinicians focused on managing people's health conditions and preventing diseases. And also you can be like a dental. You can work in a dental field, and this also is another example of an allied health profession. And dentists are in charge of examining the dental and oral hygiene of patients, offering them advice and carrying out surgeries. And also you can work in the imaging field, and these people are in charge of medical imaging. They are in charge of managing different technologies that are used to view the human body in order to diagnose, monitor and treat medical conditions. This requires to use different technologies to look at the body and then identify what a patient is suffering from. Also, let's talk about LPN, RN, and nurse practitioner levels of nursing. The LPN, which are licensed practical nurses, provide basic nursing care. They work under the direction of registered nurses and doctors. And the education requirement in this field is that you must complete a state-approved educational program, which typically takes about 1 year to complete, and also they must be licensed. The job responsibilities are monitoring patients' health, for example, by checking their blood pressure, and also changing bandages, inserting catheters, as well as different activities which are related to taking care of the patients. And also they provide for the basic comfort of patients, such as helping to bath or dress. And also let's talk about registered nurses. Registered nurses provide and coordinate patient care, educate patients and the public about various associated degrees in nursing, and also they have a diploma for an approved nursing program, and also they have to be registered nurses, must be licensed. The job responsibilities in this field are like perform physical exams and health histories, provide health promotion, counseling and education, interpret patient information and make critical decisions about needed action, as well as different activities. And also nurse practitioners work in clinics, nursing homes, hospitals or private offices. And also they are in charge of prescribing medication, diagnose and treat common minor illnesses and injuries. The education requirements in this field are having a master's educational and clinical practice requirements beyond the basic nursing education, and licensing required of all and who provide at least some level of direct care to patient populations. And that's all about this presentation. I hope that you get something about non-clinical jobs and what are some examples of allied health professions. And thank you for watching.